Okay,
Okay.
um, so we're gonna start the event now. So this event is Careers in Healthcare. So the introduction, every day healthcare professionals work together to help people feel better, stay healthy, and save lives. So we're gonna be talking about who works in healthcare. Did you know that there are many important roles beyond just doctors and nurses, and explore how you could be part of this exciting world? So the first one is roles in healthcare. So from the emergency room to the lab, it takes a team of professionals to keep people healthy. So let's take a look at some of the key roles in direct care. Direct care professionals work face to face with patients to help them feel better and stay healthy. Doctors diagnose and treat illnesses while nurses support both patients and doctors. Dentists take care of our teeth and gums. Physical therapists help people move again after injuries, and chiropractors focus on spine and joint problems, and optometrists keep our eyes healthy by checking vision and prescribing glasses. So, support roles may happen behind the scene, but they're just as important as keeping patients healthy. Radiologic technologists take images using machines like X rays and MRIs. Yeah. Um, Phlebotomists draw blood, and medical lab technicians test those samples to help diagnose illnesses. Surgical technologists set up tools and assist during surgeries. Respiratory therapists help patients who have trouble breathing, especially in critical care. Dietitians and nutritionists plan healthy meals, and occupational therapy assistants help people regain everyday skills like getting dressed or cooking after an injury. But not all healthcare careers involve patient care. Some focus on discovery data and design. Pharmacists make sure medicines are used safely. Medical scientists research new treatments and cures in the lab. Biomedical engineers design life changing tools like prosthetics and medical machines. Biostatisticians use data to guide smart healthcare decisions, and public health researchers track disease patterns to prevent outbreaks. Clinical trial coordinators test new drugs and vaccines, while genetic counselors help people understand health risks hidden in their DNA. These careers are all about advancing the future of medicine. Emergency response workers are the first to act when lives are on the line. EMTs provide basic care and quickly get patients to the hospital. Paramedics go a step further. They can give medications, start IVs, and handle serious emergencies. Trauma surgeons perform life saving surgeries for people with critical injuries, like from car accidents. Disaster response coordinators help organize medical teams and supplies during big events like earthquakes or floods. And search and rescue medics are trained to help people in dangerous places, like mountains or collapsed buildings. These heroes keep calm in crisis and act fast to save lives. So, next, we're going to be talking about physician pathways. So there are two main types of doctors in the US, MDs and DOs. MD stands for Doctor of Medicine, and they use science-based methods to diagnose and treat illnesses. DO stands for Doctor of Osteopathic Medicine. They learn everything an MD does, but also get extra training in the musculoskeletal system, bones, muscles, and joints, and they use hands-on techniques called OMT. Both go through medical school and residency, but take different licensing exams. MDs take the USMLE and DOs take the COMLEX. Both are fully licensed doctors who can prescribe medicine, do surgery, and work in any specialty. After medical school, doctors choose a specialty and go through residency training to become experts in that field. Family medicine, pediatrics, and internal medicine all take about 3 years and focusing on caring for patients of all ages, kids or adults. Psychiatry and dermatology take 4 years and deal with mental health and skin conditions. Radiologists use machines like x rays and MRIs to find out what's wrong inside the body, and that takes 5 years. General surgeons also train for 5 years to perform operations. Cardiology, which focuses on the heart, takes 6 years, including a fellowship. And neurosurgery, the longest of all, takes 7 years because working on the brain and spine is highly complex. Next, we're going to be talking about nursing pathways. Nursing is also one of the popular healthcare career choices. Both registered nurses and licensed practical nurses play important roles in patient care, but they have different levels of training and responsibility. RNs usually go to school for 2 to 4 years and can create care plans, give medications, and manage overall patient care. LPNs complete about 1 year of training and focus on basic care like checking vital signs and helping patients with daily needs. RNs often work in hospitals, clinics, or schools, while LPNs are more common in nursing homes, home care, and smaller clinics. They work together as part of a healthcare team. Now we will talk about creative paths in healthcare. Not all healthcare careers take place in hospitals. Some are creative, unique, and even involve animals. A medical illustrator uses art to create detailed drawings of the human body for textbooks and patient guides. Music therapists use the power of music to help people feel better emotionally and physically, especially kids or seniors. Recreational therapists use fun activities like games, crafts, or sports to help patients recover from injuries or illnesses. And animal assisted therapists work with trained animals like therapy dogs or horses to help patients cope with stress, anxiety, or trauma. These careers show that healthcare can both be helpful and joyful. So now we'll talk about healthcare around the world. Healthcare is a global mission, and medical professionals work in many different settings, not just hospitals and cities, to help people everywhere, especially in places with limited access to care. Mobile clinics are like mini hospitals on wheels that bring doctors and nurses to remote areas where there may be no clinics at all. Rural healthcare is about serving people in small towns or villages where doctors might be limited. But the need is just as important. With telemedicine, technology like video calls allows doctors to treat patients from far away, even across countries. And organizations like Doctors Without Borders send medical teams into crisis zones like war areas or disaster sites to provide urgent care. So now we'll talk about skills and future trends. So we've talked about the jobs, but let's talk about the key skills that you need to prepare for these careers. It's not just about science grades, it's about how you think about it and how you treat the people. First, with empathy and compassion. Empathy means trying to feel what someone else feels. In hospitals, that might be noticing a patient is scared and saying, I get it, this is tough, I'm here to help. Compassion is turning that feeling into action, like explaining a test in simple words or holding a hand. Attention to detail. Details keep people safe. A phlebotomist or lab tech must check the patient's name, label the sample correctly, and follow the steps in order. One small mistake, like mixing up labels, can lead to the wrong results. Double checks and checklists are their superpowers. Problem solving and critical thinking. Doctors and scientists are like detectives. They gather clues, like symptoms, test results, and data, and then ask what's really going on. They try ideas, see what works, and change course if needed. It's not guessing, it's smart testing. Teamwork and communication. Healthcare is a team sport. Nurses, doctors, techs, and therapists share information clearly, who's doing what and by when. They repeat back important instructions to avoid mix-up and ask questions like, what are we missing? When you put these four together, kindness, carefulness, clear thinking, and good teamwork, you help patients feel better faster. Next is innovation in digital health. Let's look at three forces reshaping care right now: AI, robotic surgery, and next-gen diagnostics, and what they mean for clinicians and patients. Artificial intelligence. AI is like super fast helper for doctors. It can look through tons of information like x-rays and test results very quickly and point out things that a human might miss. It doesn't replace doctors, but it gives them clues so they can help patients sooner. Robotic surgery. In some surgeries, doctors use robot arms they control, kind of like super precise video game controllers. The robots help make tiny, careful movements so cuts are smaller and patients often heal faster. The doctor is still in charge the whole time. Next-gen diagnostics. Smartwatches and home sensors can track things like heart rate, sleep, or blood sugar all day. If something looks off, they make time. If something looks off, the device can alert the person or their doctor before it becomes a big problem. It's like having a healthcare checkup in your pocket. When you put these together, these tools help doctors find problems earlier, fix them more gently, and keep people healthier at home overall. So now high school clubs and projects. So here are some dedicated pre-health clubs. One of them is HOSA, which is Future Health Professionals, formerly Health Occupation Students of California. This is the premier student-led organization for future healthcare professionals. What they do: leadership development, clinical skills, and competitions like medical terminology, pathophysiology, and CPR, and community service related to healthcare. The High School Alliance of Future Physicians. This national organization is focused specifically on the path to becoming a physician. And what they do is they give us access to shadowing and research opportunities and workshops on medical skills. Then we're going to be talking about other ones. So the T-STEM programs are Texas STEM and Austin ISD high schools that often include a biomedical science pathway offering excellent pre-med preparation. Many Austin high schools, like Navarro and Ekins, offer specialized health science sequences through their CTE department. The Science Olympiad or Science Bowl. These competitive academic clubs are excellent for building the necessary science and logic knowledge base required for medical school entrance exams. The Key Club and Honor Society. While not health-specific, pre-med track students need strong community service hours, which these clubs provide. Okay, so now we're going to be doing a quiz on what we talked about. So can you tell me who gives medicine and explains how to take
B.
it? B, yeah. Who helps people walk again after an injury?
C.
Yeah, that's correct. Who researches new medicines and cures?
D.
Yeah, that's correct. Good job. Who treats problems with bones, muscles, and joints, especially the spine?
C.
Good job. Who draws blood for tests, donations, or research?
D.
The answer is A, because a phlebotomist is usually the one who deals with blood. Who designs medical devices like prosthetics, imaging machines, and artificial organs?
D.
D?
Yeah.
The answer is biomedical engineer because radiology technologist focuses on X-rays and MRIs. Which medical specialty treats infants, children, and teens?
D.
Wait, sorry, I could not hear
D.
you. C? Okay. Um, in addition to standard medical training, what do doctors of osteopathic medicines receive extra training in?
B.
Did you say B or D?
B.
Okay, the answer is D, because they need this specific kind of training to be able to get DO. What is one main difference between a registered nurse and a licensed practical nurse?
Is it B?
No, the answer is A, but close, yes. Which medical specialization has the longest residency?
C.
Yes, that is correct. Good job. So now that we're done with the quiz, this is like an extra slide, but that's basically it for the healthcare's presentation. So I hope you learned something. Do you have any questions?
No.
Okay, then I think that's it. So thank you for coming.
Okay, bye. Thank you.
Bye.